Welcome to Town Hall, folks. It's 7:30, and we're going to get started with our meeting for tonight. We also have a special presentation planned that involves a presentation from TRC about their sampling for air quality. What our goal is to have you briefly present the results of your study with a focus on anything that relates to public health. Essentially, we know that odor is also an issue, but that this report pertains mostly to the question of health. And then we're going to have a couple of questions from members of the town board. We also have some questions from members of the public, and if we're really good, maybe we'll be able to take a couple of questions on the fly from the floor. You won't be able to hear them, but we will repeat them for you and look to spend maybe 25 minutes or so on this before we get back to other questions before the town board tonight, knowing, of course, that we'll have to follow up with other questions that probably will get kind of jogged loose, and we'll get them via email in the next few days and then send them to you. Okay, how does that sound as a process? Sounds good. Okay. Can you guys hear that? Now hold on a second. I'm going to put the microphone right next to the speakerphone here. So, all right, hold on. Just try saying your name there and see if people can hear it.
Sure. My name is Karen Vetrano. I am a senior toxicologist and human health risk assessor with TRC Environmental Corporation. Unfortunately, our air is not pristine. It is you end up having a low level of chemical constituents just by virtue of our everyday activities.
That's a great introduction to the results of your study, and we thank you for that. I think we're going to switch modes right here and take questions from the town board related to clarifications. I'm going to start out with Councilman Divany since he had a prior relationship. Do you want to start with any questions or clarifications for the?
Yeah, she answered a lot of what I was going to ask, but hi Karen, Tom Divany.
Hi.
Just to, if I know a lot of people may be concerned that walk the rail trail and that live in the area, and just so everyone knows, Karen was the odor expert who walked the rail trail for 5 days back in July and August, so she knows the area. She was running up and down that rail trail when she was there.
Honestly, and I had my bike too, and I was more afraid of riding my bike on 303 as opposed to, being exposed to anything. Yeah, honestly, these concentrations are, I would have no qualms with, using the rail trail and being outside activities or any of that type of thing.
What about if you live in around Murphy Court or on Arthur?
No, again, these concentrations are they're what's in the air already. Nothing that we saw, would be so. When I was getting back to describing how the state uses these AGC and SGCs by using measuring what comes out of the stack and using the dispersion modeling. From what I understand, that was done for the facility, that there were, emissions were measured coming out of the stack, and the air mod model, which is the dispersion model, was applied to these emissions. And acrolein ended up being was the common denominator between that study and what we did. I don't believe that they looked at some of the other ones that we analyzed for, but acrolein was in that analysis. And the concentrations coming out of the stack and going through the model did not exceed either the SGC or the AGC concentrations. So, which indicates to me that, the concentrations that are being found in ambient air are more as a result of common everyday activities such as the traffic, et cetera, versus what's coming out of the facility stack. So yes, maybe, your concentrations, you may be higher than an annual concentration, but again, it's still, these are concentrations that are developed using large safety factors. Just because you exceed them doesn't mean that there's going to be a long-term health effect. And again, it's background, which means it's something that's going to be there consistently. It's not something that can be cleaned up unless, you deem that area that the city goes to, all electric cars and, you're not burning gasoline or oil or wood or any of that type of thing. It's just something it's there all the time. And so it's not at a concentration that's going to be causing like an acute health effect, such as, the watery eyes and that type of thing.
All right. I mean, you hit on most of the questions I have, because one of the questions was, were the concentrations in line with the average concentration of other communities? And I don't want to put words in your mouth, but I think you already answered that.
Yes, and also to step back, that one of the recommendations that we've made, and Tom's agreed to, is that I guess there's going to be another round of sampling, and so one of the things that we want to look at is to do a local background evaluation as well, just to get to see what that local what their local ambient air really looks like, as opposed to using the data that we used was peer-reviewed data, but it was it was not specific to Blauvelt or Orangeburg itself. So.
And by that, I talked to Dr. Vetrano. What we want to do is do testing in other areas of Orangetown to find out how this area compares against, say, Pearl River or Tappan. So that's something we can do. We will do a second round of testing once Aloof installs this ventilation system and turns it on to see how the samples have changed. So Dr. Vetrano suggested it about doing it near 303, but it makes sense to do maybe 304 in other areas of town. And the last question I think you also hit on is that, is it possible to completely eliminate these chemicals? And again, I don't want to put words in your mouth, but I think you already answered that.
Yeah, no, again, it's because they are pretty ubiquitous, they're a consequence of our everyday activities, that there is always going to be a low level, of these types of chemicals in our ambient air.
Okay. That's all I have. Does anyone else on the board want to ask?
Yeah, I do. I wanted to ask Dr. Vetrano if she experienced the noxious smells on different days and on different parts of the area there when she was doing the testing.
Did you hear that question, Doctor?
Yeah, whether I had actually smelled some of the odors. There were a few days that I did detect an odor. It was nothing that was really very strong. So I don't know if any of you saw me walking around with this. It was called the Nasal Ranger. So I had this, it was like a face mask. They had this big tube associated to it. So I was walking around the bike trail and through the neighborhoods with this thing. So, so what this is it's called a field olfactometer. So it makes, there's a dial that has apertures, like little holes that allows a certain amount of ambient air come through, and then it gets diluted with air that comes through carbon filters. And so so I can go anywhere from a 2-fold dilution of regular air up to a 60-fold dilution. And I believe, and I'm sorry, I did not get, here, I'm just opening up the report and the table of the results. I believe I only had a few instances where I did smell something, but really it was nothing. It was actually less than a 2-fold dilution, meaning I was able to smell it just in the ambient air without using the nasal ranger, but once that I made it as low as just a twofold dilution, I was unable to smell anything. And there were, like I said, there were a few instances that I did smell like a hot plastic chemical type of odor, but it was, very infrequent. I was getting a lot more, probably I think the second day I was there, I think I probably had 2 or 3 instances of actually smelling that odor. But again, it was nothing more, it was less than a twofold dilution.
Just to follow up on that, because this is exactly following up on Dennis, and then I'll go to Paul. The question as to the overlap in sampling of the ambient air with odor incidents, because, was that a part of the study to try to capture air samples during odor incidents, and how did that affect your analysis?
I think the VOC sampling was conducted after I was there. I was there the first week of August.
Okay, so it's a separate bunch of stuff.
So I
That's
was
included in
doing,
this
what
report.
essentially what I did was, I went out, I did essentially 1, 2, 3, I did like 4 to 5 circuits a day, starting at Mountain View and Glenshaw, and then just went up the bike trail and then went through the neighborhoods and then came back down 303 and just made that big loop. And so I was doing that about 5 times a day. I actually I think there was one day that an odor complaint had come in the morning, but by the time that it was relayed to me, it was probably about a half hour to an hour or so after the complaint came in. So although I went to the location to try to see if I could verify the complaint, I think too much time had already gone by. So, at that time I was unable to verify that, the complaint itself in that location. But in terms of the ambient air sampling that took place after I was there doing the odor survey.
But
Doctor, I have one quick question. My name is Paul Valentine. I'm a councilman. I live in Blauville. My commute from my office to my house is right down Erie Street. So I'm in this area all day long with my kids and my grandkids. So I live here and I work here. Do I have anything to be worried about? In simple layman's terms, do I have anything to be worried about?
No.
Thank you.
Andy, to that question that you asked, Dr. Vetrano did take the sampling that was done in response to odor complaints. We did, I think there was 10, and it is included in the report that she has written up.
Oh, those, the resident complaints, is that the resident?
The resident
air
samples with the 1 hour to 2 hour
Okay, so those were 1 hour samples. So again, those were pretty much, they were still in line with what was those 24-hour samples. They really were not significantly different from those samples. So, which again tells me that, that it's pretty much in general, what, the concentrations that are in the ambient air. And so based on that, again, I think it's typical of what's in the location, just based on, everyday activities that's going on there. And, I don't believe that they're attributable to the facility. And, at the concentrations that I was seeing, that I do not believe that, there's, any health effects would be expected from those concentrations, exposure to that.
Jerry Vitari has a question.
Doctor, the burning of plastic, would that leave these chemicals in the air? Would that produce them to be in the air?
Hold on. Not chemicals like the benzene. Let's see. So according to, ATSDR, primarily the types of things that, it's going to be, yes, it could be formed from burning tobacco, wood. It does look like some plastics, gasoline, diesel fuel, wax. If you're cooking and you're heating animal and, vegetable fats and oil at high temperature, the human body actually produces acrolein in very small amounts. So again, but this is, when we're talking about burning plastics, this is more like an actual fire, when it's so that, and plastics are being burned in an actual,
As opposed to melting?
yes.
Okay, so then the ambient air would not have any odor in and of itself that would be detectable.
Well, again, odor, and this is, just odor generally, the human nose is a very sensitive instrument. And so, people can, detect very small concentrations of a compound that can actually even be below detection levels of an instrument. But just because you can smell it does not mean that it's going to be toxic. And so, so it is two different things. So I'm not saying that, you're not smelling anything. When I was there, it just happened that, I wasn't detecting anything when I was doing those fruits. And I believe that one odor complaint that day was the only one that came in that week that I was there. So, I just happened to have gotten a week that, wasn't a big odor impact week. So I'm not saying that there's no odor impacts. I'm just saying that when I was there, I didn't detect anything. And again, in terms of odor's the other hat that I wear. I've been doing odor at TRC for 25 years, and I actually manage the odor control and measurement group, and I have a lab in our Windsor, Connecticut office. So I do both. And, so what I'm saying is that the air concentrations that were measured, are within background that have been, documented, across the United States, as well as within New York State. There, in the case of the benzene and carbon tetrachloride, there's way below concentration, short-term concentrations that would be expected to cause a short-term health effect. The acrolein is only about 2 times higher than the SGC. So again, it's not at a concentration that it would be expected to, you'd expected to see any effect because, again, what was seen in, normal volunteers was around 140 to, 180 micrograms per cubic meter. So from the data, the air sampling that was done and that data, there's nothing in that data that's jumping out at me that's saying, that there's going to be a health issue related to these air concentrations.
Okay, thank you.
Thank you. All right, you got the questions from
I have a set of questions. I'm going to defer my own and just hit this list because and we'll do a few of them, and then we're going to have to follow up. But I'm just going to give brief answers if possible. The first one was just to explain a bit about how data collection works. How did you collect the ambient air data?
Well, I wasn't involved with the sampling. I believe they used SUMA canisters, which it's a canister that's under negative pressure that has a valve on it that it's set to release, or it's set so that a certain amount of air comes in over a designated time period, which I believe was 24 hours. Once that time period's done, the valve is closed, then they're sent off to a lab for analysis. And then, we receive the data from the lab.
Okay. just skipping down a little bit here, I think you mentioned this before, but the question of cumulative impact of in terms of health effects from the combination of pollutants together is one question, and then cumulative over a lifetime of residency in the area is another question. If you could just touch on those each briefly.
Well, okay, so when we do human health risk assessments, we actually, backing up, there are no studies that have analyzed a mixture of constituents, just because you can never predict what specific chemicals are going to be in that mix. Okay, so when we do a human health risk assessment, we assume that the health effects are additive if it's a non-cancer type effect. So we have a concentration that EPA has come up with that says, okay, below this amount, somebody can be exposed to this for a lifetime, 24 hours a day, for a lifetime, and not expected to, experience any health effects. And so what we would do is then compare what the concentration is to this, essential safe dose, and then say, okay, how many, is it below this number or above this number? If it's above this number, we calculate a ratio. Is it 2 times? Is it 3 times, et cetera? So if we're looking at short term, we can do the same type of thing. So these concentrations, again, acrolein was slightly above the short-term value of 2.5, so we're somewhere around, we're about 2.5 times, the SGC. But again, we're looking at background, so you can never clean up background. And because of that safety factor that's built into it, we can, be pretty assured that, it's going to be at a concentration that's not going to be causing a health effect. It's not a bright line. It's not saying you go over it, you're going to be sick, It's just saying that we know if you're below it, you're definitely not going, we know there's going to be no health effects, and we've built in a safety factor to this number. So even if you're a couple times higher, you should be, it's going to be okay. All the other compounds didn't, like I said, benzene and carbon tetrachloride, their numbers are in 1,300 and 1,900 micrograms per cubic meter, and we're at less than a microgram. So there's no short-term effect associated with those at all. And again, in terms of the lifetime exposure, these numbers are calculated for to be at a 1 in a million cancer risk. So EPA considers a range from 1 excess cancer risk in a million to 1 in 10,000 to be acceptable. The current cancer risk in the United States is 1 in 3. So we're talking, so if you look at it in decimal points, it's, 1 in 3 is 0.33, right? So if you go out to a million, you're going to add another 4 zeros and a 1, and that 1 is that 1 in a million cancer risk. So you're not even, in terms of rounding, even affecting what that, based on that 1 in a million cancer risk, would be affecting the normal cancer rate in the United States. So that's very protective. Again, none of these numbers are below the, carbon tet and benzene were above the AGCs, but they were, they were still, which is calculated at 1 in a million, but they were still within the acceptable range of that 1 in 10,000. So if we were doing a risk assessment on this, we would still say that it's within an acceptable, probability that there would be at least, there would be an excess cancer risk associated with this exposure. But again, it's background. It's ambient air. That's something that's always going to be there. It's something that everybody lives with every day. there's always going to be an associated, just a background mix that everybody's exposed to
Quick question.
based on cars and that type of thing.
A follow-up question, thank you for that. It just has to do with children with respiratory conditions or other people who might be more sensitive to, would these results have any implications that are different for, say, a kid with asthma or someone else with a respiratory condition?
Well, so the acrolein number, that when I was describing putting in those uncertainty factors, they put in that uncertainty factor of 10 to as a safety factor for sensitive individuals.
Okay. Right, I remember you said that.
Yeah, so it, so they're taking that concentration in a normal person and reducing it by first a factor of 6 because they only saw lowest dose. They didn't have a no observed effect level. And then on top of that, they reduced it again by 10 to say, okay, now we want to put an extra factor in there to, for kids or, the elderly, so sensitive individuals. So that's already built into that number.
We could go on like this, getting more and more detailed questions from you, but we do have a lot of other business to take care of tonight, and there will always be leftover questions that we need to consolidate and send to you via email.
That's fine.
So I want to leave off there, but I do want to make good on my promise to our guests tonight to allow for at least a couple of questions from the floor. Kathy Kelly.
Yes, hi. I would like you to ask the doctor, though I appreciate her.
Kathy, could you just come up to the,
Right, this doesn't count as my 3 minutes, right?
No.
if you want to make a public comment later, then hopefully it won't repeat what you're about to ask.
Hi, Dr. Vetrano. This is Dr. Kathleen Kelly. What I'd like to know is, I appreciate your expertise in toxicology, master's and PhD prepared. What I'd like to know is, what exactly is your expertise and training in health risk?
The question had to do with your training or credentials in health risk assessment.
I have 27 years of experience conducting human health risk assessments for US EPA, for New York State, and various other states under federal and state guidance.
Okay.
I also am work on behalf of 2 state agencies as well as the government of Puerto Rico as a regulator and reviewing risk assessments conducted by others that are then submitted to the state.
Right, but do you have any medical degree?
She wants to know if you have a medical degree, and then we're going to go on to the next question.
No, I have a PhD in toxicology, and generally, human health risk assessors are toxicologists. You don't usually get medical doctors doing environmental human health risk assessment.
Thank you.
Ask if there's anybody else.
Anyone else have a question?
Yeah, for specifically for the doctor, yes, sir, in the striped shirt. Is acrolein a mutagen? The gentleman wants to know.
No.
All right, another hand up. Yes, ma'am, in the back there with the glasses and the black sleeve.
You,
You.
right
Yeah,
there.
you.
Hi, what are the most likely causes of odor that residents are complaining about?
Does your study cover the causes of the odors the residents are smelling?
Which study?
Okay.
Which one are we talking about? The odor study or?
The question is, what are the most likely causes of the odors that we've been smelling?
Well, in terms of the odor study that I did, I just did a survey of the neighborhood. So generally when I go in, if I'm doing a comprehensive odor study, I'm at the facility, I'm doing a inspection of the facility. We actually take samples from the stack itself and then bring them back to my laboratory where I actually have a volunteer, well, I do pay them, but they are it's an odor panel of 7 people that actually smell odor samples. And I have a I kind of described this field olfactometer. I have an olfactometer in my laboratory, which essentially makes dilutions of, the odorous air. And so I have these people smell these samples, and they provide odor character and, what it smells like and that type of thing. And then, so, I generally do a full when I do that type of study, I do a comprehensive study. At this point, all I've done is the odor survey, and that's just documenting the types of odors that I smelled and where I smelled them. I mean, I didn't just smell, the hot plastic and the chemical odors. There were asphalt odors. Over by the barbecue joint, I was smelling barbecue. Somebody cut their grass. So, I mean, I documented all the odors that I smelled, and there were a few instances, like I said, that I smelled those chemical odors. But in terms of actual what it was causing, I'm assuming those odors were coming from the facility because the wind direction was correct, but I haven't done direct sampling at the facility itself.
Right, that's been other studies.
That didn't really answer my question. What I was asking was, in her expert opinion, what are the chemicals that she thinks would be causing the smells that people are reporting?
This question, it might not be for you because there were others involved with evaluating the facility itself and the stack test for odor-causing chemicals. But the question is, in your experience, what would be the chemicals causing the odors we're smelling? Is that something that you can answer?
Yeah, no, I can't, not at this point, unless I don't have the actual stack analysis data to actually look at that and then compare it with, odor threshold values and then known odor characters. And the other thing is that it's a mixture. What's coming out of the stack is going to be a mixture of various chemicals. It's not necessarily that you can actually pinpoint one exact odorant. It's probably a mixture of odors and so various chemicals. But I can't speak to that at this point.
Okay, I see a hand up way in the back, purple sleeve.
Yes, when the doctors start discussing the extent to which the 24-hour measure is not comparable to the year measure, she said that she wished she had been consulted prior to the study. So my question is, how would she have designed the study, the sampling, and what kind of sampling would she have used to collect data that are comparable to the standards? Because now she's comparing a 24-hour measure with a 1-hour measure. And so how would she have done the study to get good data?
I think I'm not going to speak for the doctor, let her speak for herself.
Yeah, I'll let you take a stab at this question. It essentially is, you had mentioned you had your involvement with the design of the study
No.
was, I think I got it.
Let her repeat her question.
All right, go ahead and repeat your question.
Yes, thank you. You mentioned at first that when you were discussing that the 24-hour measure is not comparable to the 1-year measure, you stated that you wish you had been consulted prior to the study. And so my question to you is, how would you have designed the study and the specific sampling, particularly because you're now comparing data to 24-hour sampling data to 1-hour thresholds. So how would you have designed the study to get data that are comparable to the
Okay,
standard?
I got it. Yeah, and just to clarify, it wasn't that I would have changed the design of the study. It would have been what values that they would have picked to compare them to. So I would not have compared them to the annual values because it is a short-term study. Again, the SJGCs and AGCs were never developed to be used for somebody to go and collect a sample, such as a SUMA sampler for ambient air, and then and to be kind of used in these kind of ways. These values were developed to evaluate stack emissions from a facility for based on permitting processes. But because they're generally health-based, and so they're based, it's a New York State developed number for a short-term exposure and an annual exposure, it kind of gives it's a number developed by the state. So What I was saying is I would not have done the comparison with the annual numbers just because it is a short-term study. There's no way to act, I guess technically there would be a way to take an annual average that, but it's going to cost you, it's going to be, it's cost prohibitive as well as, technically it may not be feasible to actually somehow do a full 1 year monitoring, of collecting annual data. So, I know like the state does have, as well as the federal government has set up in specific areas, an air quality control system where they do take daily measurements of specific compounds. In fact, the benzene, the numbers that I was cited for the benzene study, those were EPA air quality system values taken from New York. So, so it would be, you'd have to do continuous monitoring and then, get an annual average at specific locations. And, for this type of study, it's not feasible. So again, it wasn't that I would have designed the study any different. It was just that I would not have taken those numbers and compared them to the annual numbers. So hopefully that clarifies that issue a little bit.
Yeah, thank you for that. Another question from the floor. I'm going to go with the gentleman right in front here in the blue T-shirt.
You stated in the beginning that these were normal samples, but you only stated one time in the beginning that they were normal for high traffic areas. But how is it high traffic area on the rail trail in our schoolyards? I mean, that doesn't make sense to me, that test for a high traffic area, and there's never been testing for high traffic areas, you said. But like, what about all the studies in the Manhattan bus terminals and stuff where they found that the air quality had negative effects and stuff? I don't understand when you say there's no studies that have taken place. That doesn't even make sense to me. And I don't understand how it's a high traffic area in these points.
So did you get the question, Doctor?
Parts of it.
Okay. It has to do with the background, what is considered to be a normal level of contamination with regard to a community like ours. You may have used a phrase like high traffic area.
I don't think I used high traffic, but I might mention traffic.
A bus depot where there's much higher exposure. So the question, I think, is, relates to, when you looked at those baselines for the normal level of contamination in the air, what is that normal? Would it include something like a bus depot, or is it a suburban environment with a nearby highway like we live in?
Well, there was a mix. Like, I believe when I was talking about the carbon tetrachloride, that was a rural background number of 1 microgram per cubic meter, and you're below that. Let's see. I'm sorry. Let me just go back to my text here.
So just to clarify, the background level that we're being compared to, would that bear any resemblance to a bus depot or a heavily urbanized area, or do they have a different normal?
What I presented was a range. So, for example, from the benzene, it was a range from 0.33 to 0.91. So, so the values that I presented were a range. Again, same thing with the acrolein. They don't provide, this came from a specific, location. They provided a range. So I can't tell you exactly at what particular. It would have been taken from. It wouldn't have been taken at like a bus depot or an urban tunnel or something to that effect. It would have been a measurement of ambient air. So, and it would have been across a range of types of locations, from rural, suburban, as well as an urban location.
Okay. I'm going to take 2 more questions. I'm going to go with Eileen Larkin, since she's such a regular here and can be counted on to something that other people want to hear, and then we're gonna do one more, and then if the town board is okay with it, we should probably move on with our meeting and accept emailed questions that we will consolidate and send to the doctor.
I'd like
Yes,
to
ma'am.
ask the doctor that the time she did the time frame that she did the studies, was Aloof running at 100% activity during that week? And were they aware of the fact that she was there doing these studies? Because I think that's important to know what was going on at Aloof during that time frame. I believe she said she did it in August, which to me as a vacation time is kind of a lull in the world of business that they, so I'd like to know if Aloof knew that she was in the area and if they were at 100% production. Thank you.
Could you hear that?
No, I did not.
So the question has to do with the concern that Aloof may have been able to manage their emissions if they knew there was sampling going on. Now, are you aware if the sampling that took place was, what the level of activity in terms of Aloof's manufacturing activity was during that period, whether they had any
In terms, so the VOC sampling? So this is for the report that we just submitted.
I know there's been several efforts at sampling.
So there's the odor report, which we talked about when I did the walk around, or the VOC sampling, the ambient air sampling.
That one, the ambient air.
Okay, so again, to clarify, I was provided the report after it was submitted already to the town. I had no input at all with, timing or anything. So I don't believe that TRC had contact with the facility to let them know that sampling was going on. I know I didn't have any contact with the facility when I was doing the odor surveys. I talked to nobody at the facility at all. So, and I'm not aware that TRC had contact with the facility when they were doing the ambient air measurements, because we did not take any samples on the facility property at all. So it was it was only in the surrounding neighborhoods. So as far as I know, we did not. We can most certainly, if among those questions, that you're submitting by email, if you can resubmit this one as well, I can double check with the project manager who was in charge of the sampling to verify that information. But like I said, as far as I know, we had no contact at all with the facility.
And just to add to that, we did do canister sampling by residents that were in direct response to odor events in the community. So what would happen was someone would smell a certain smell in the community. Certain volunteers were shown how to use these canisters, and they would deploy these canisters for 1 to 2 hours to sample that odor. And the report says that those 1 to 2 hour samples are almost on par with the ones they've done in the summer. So, I mean, we were reacting to an actual odor event. So, I don't know how they could know we were going to measure that sample. We're reacting to the smells that occurred. I just wanted to add that.
Okay, I'm gonna take one more question, the hand up in the back there. Excuse me? Sorry. I see a hand up. It looks like Allison.
Yes, I just have something to add to what actually Tom Diven is saying. The interesting thing about taking those samples was we would report the odor, and then the DEC would tell Aloof that we reported the odor, and then we would take the air samples. And I understand the odor was going on during most of those samples, but they were always aware of what was going on.
Yeah, it's an unfortunate reality that they've been aware of our concerns about odor for a long time, and for a long time it didn't make any difference whatsoever in their behavior. So I think that unfortunately, maybe they're able to sort of jimmy their production if they think some air sampling is going on, but it seems like they've basically been oblivious to our concerns and have only responded to court cases and DEC and town permitting. I think we need to, we're going to wrap up this presentation by the doctor, and we're going to continue on with our public comment period. And folks maybe want to speak to this issue some more, but we're gonna let her go because she didn't sign up to be here for too long tonight. We very much appreciate your information tonight, and we will have more questions for you via email, Dr. Vetrano. We really appreciate the time you've taken tonight and the work that you've done for the town so far.
Andy and I were talking about it. We will forward the questions, but we will forward them in batches just so Dr. Ventrano can answer them at one time instead of, one at a time, because it just is not efficient. So you can get us the emails. I talked to Dr. Ventrano a number of times. If you have questions, just email it to the entire town board. I'll make sure that she gets it, and we'll get your responses back from Dr. Ventrano.
Let's continue with our public comment period now.
Just one quick thing. Is November 10th the new date from Aloof that they're having the equipment in?
The equipment is here tomorrow.
But I'm saying when it's installed.
The equipment's here tomorrow, and I was advised it would take 6 days, but we were advised the equipment would be here 2 months ago, Dennis. So.
No, I agree with that. The date keeps moving out, but I thought that the DEC was giving them November 10th.
George said that there's a turn-on date, installed and running on November 11th. And
That date has changed.
we're all going to want to see that in black and white, and of course, we're going to want to experience a dramatically reduced odor problem, and hope that is actually what happens.
I just have first a question for all of you. Who has smelled the odor? I know Tom has.
I think we
I
all
know
smelled
Andy
it, yeah.
has. You have? You've all smelled the odor we're talking about. Okay,
course.
all right. I just wanted to ask. I know, Dennis, you haven't. I know, and I know why.
Okay, so
Yeah.
I don't have to tell you why. Okay, thank you.
All right. There's one thing that has become abundantly clear to me through the process, through this process. It is that at this present time, for various reasons, the Orangetown Board, the Planning Board, the ZBA, and the Building Department have limited ability to regulate manufacturers that already exist in this town. Mistakes and misjudgments of past boards are coming to the surface. A plastic bag manufacturer allowed to grow tremendously with little or no oversight. A company who knew how to work the system. A company with a lawyer who was friends with a building department director. A company who has fires, odor reports to the fire and the police department, odor complaints for years to the Rockland County Health Department. Hopefully these odors will go away in early November when Aloof finally finishes the work 8 weeks after the deadline that they gave the ZBA, or that the ZBA gave them. There have been 78 reports of odor over the past 8 weeks. 25 days out of 56 days, we had reports of odor out of those reports, how many times did anyone from the building department or town investigate Aloof or surrounding companies? Yesterday, we had 6 people in my neighborhood alone complain. Tom Divney, Joe Moran, and Guy showed to test the air, to which I am very grateful. But my question is this: why aren't you checking Aloof or Avery Dennison or Innovative Plastics or any of those manufacturers along that LI zone and determining where the odor is coming from and finding them on the spot? According to the DEC, Aloof admitted yesterday the odors were from them. They claimed to have had the roof open to prepare for installation. How can they be allowed to operate and spew odors with an open roof? This violates town codes on odor, and they openly admitted it. A couple days ago, the DEC, a gentleman from the DEC asked me, "Why would you stay?" I would think after 15 years, 15 years, I would feel like you, but my frustration would have made me move. I was in disbelief. I couldn't believe someone would ask me that, especially from the DEC. Is this how the town board wants me to, what they want me to do? I could have just quietly sold my house and let others deal. But I love Orangetown, I love my neighborhood, and my family is here. What a cowardly question, and I hope you can do better.
Kathleen Kelly, Pearl River, New York. So when Dr. Vetrano was on the phone, she stated that the concentration of acrolein, after she did her calculation of dividing by 60, was 2.5 micrograms per meters cubed, but that some exceeded 7.3 micrograms per meters cubed. I would like to remind everyone that those of us in the medical community with degrees in medicine in the medical community look to the research and the evidence to make sure that what we're saying is accurate if I'm discussing your health. And I would hope you would expect that from everyone who renders care for your health. The World Health Organization, who is the organization that actually is the one who you should refer to when discussing people's health, suggests that a tolerable acrolein intake is 7.5 micrograms per day. That's what they suggest, 7.5 micrograms per day. So imagine the people living near here at 8 hours at a time smelling that, if that's what the canister got in an hour or two. That's a little frightening to me. For the second thing is that the Dr. Vetrano, which I do absolutely respect her expertise in what she's saying, to say that things are ambient in the air and so that they're fine. Well, cigarette smoke is ambient in the air, but I wouldn't let my child sit next to someone who's smoking and take that in. And I don't think anyone here in the room would allow their child to sit next to someone who's smoking just because it's ambient air and it's always been in the air. That's not really fair. We protect our children even though it's considered okay. I'm glad they're doing a second round of testing, and I would really like it to be at times when people smell the smell strongly, because that's when we're going to get the true sense of what's going on. And I appreciate the question of where the range came from, because if the range is 1.1 to 7.3, and the range was taken in an urban area, not a rural area, our rural community is now quickly becoming an urban area, and I don't think that that's what we really want to do. And lastly, I read many of Dr. Vetrano's other reports and work that she's done in New York City as well as for other areas around New York. She specifically always discusses children and the cumulative effect on children because of their small airways, their developing brain, and their thin epidermis. I was conspicuously confused as to why this was all neglected to be noted in the report that was given to us regarding aloof and the possible toxins coming out of that site. As well as she mentions athletes, because of their sweat and deep breathing, that exposes them more to these things coming in. Sweat sticks things to your skin, and deep breathing takes the toxins in. And the Dominican athletes are right in that area as well. So it was conspicuously absent. Thank you so much.
Thank you. Heather Hurley?
Good evening, Town Board. Heather Hurley, Pearl River. First, I want to thank Dr. Vetrano for her preliminary analysis regarding the results of the TRC air sampling. That said, I'd like to point out some facts surrounding the last 20 months of our work, research, and our own discoveries as they relate to the phase 1 testing. Dr. Vetrano said about 3 times that it was not attributed to aloof, the acrolein. Acrolein has been identified in the stack test as specific to aloof's manufacturing by the New York State DEC data with concentrations which exceed the New York State DEC short-term and annual guideline concentrations. George Swyker of the DEC said, quote, "The stack test showed acrolein, and so did the town's TRC ambient air testing. Also," he said, quote, "is produced when the plastic is extruded at high temperatures." In the TRC initial analysis received on October 13th, 2017, page 15 states, TRC suggests air sampling for aldehydes in accordance with US EPA method TO11. The objective of conducting air sampling specifically for aldehydes would be to, 1, determine the presence and concentration of aldehydes in the air surrounding aloof, and 2, to confirm whether or not aldehydes from aloof are contributing to the odors detected by residents. In September 2016, I personally addressed this issue and advocated for aldehyde testing because the first round of DEC canister sampling in September of 2016 did not include certain chemicals, aldehydes being some of them. The New York State DEC also suggests now that testing for aldehydes be done. On August 7th, 2017, the New York State DEC states in an email, quote, "During the stack test, we discovered that the air was more contaminated leaving the building than the air entering the carbon unit." On September 15th, 2017, the New York State DEC states in an email, quote, "You have to understand that during a stack test, the company is watching their operations very closely. No burning or high temperatures through the stacks. The inside of the building gets a blue haze and contaminants build up and then are released to the environment at a level above the odor threshold." And then he states about emissions, quote, "Fugitives are tough to get a hold of." Months ago, before the DEC required ALOOF to implement an equipment upgrade, members of Clean Air for Orangetown advocated for chemical scrubbers to be installed after consulting with industry professionals. These comments were made by Clean Air for Orangetown to the New York State DEC via email and submitted by an independent community-hired company called Environmental Odor Consulting to provide technical expertise regarding the New York State DEC recommendations being made back in July 2017. The suggestions of requiring the installation for chemical scrubbers or biofilters were not considered by the New York State DEC at the time, but now, months later, the New York State DEC states, when pressed for an answer, quote, the removal efficiency of the carbon unit was extremely low, indicating that it is not an effective way to control aldehydes. We are in discussions with ALOOF about a new control device, which leads to your Plan B question. Plan A is the ventilation upgrades to address the inside air that escapes as fugitive. Plan B, which we already are implementing, addresses the stack control equipment. We are currently having discussions with ALOOF to change to a different, more efficient piece of control equipment. A scrubber, since all of the emissions are miscible, is being discussed. We will be implementing this Plan B in addition to Plan A to further reduce emissions. But when that will happen, the public remains in the dark because we don't know when that would be complete. And finally, the EPA National Enforcement Investigation Center, GMAP, monitored ALOOF on August 27th, 2017, outside of the fence line. This unit consists of labor absorption technology in the form of an integrated cavity output for methane and other chemicals, a differential ultraviolet absorption spectrometer for benzene, toluene, ethylbenzene, and xylene measurements, a global positioning system and other pieces of equipment, and a collection station for air canister sampling located in a mobile device, and stated, quote, "If the readings are higher than expected, we would want to investigate. As of this meeting, we have not received these EPA results, and we're advised that they will not be available until sometime in November." Okay. And then one last part is that, again, that the resident canisters that were deployed, that the 1-hour ones, they were taken during odor events, and they are comparable to the 24-hour samples. And in closing, the receipt of this preliminary analysis does not mean that we are finished with our work. We look forward to obtaining more opinions on this data, an analysis of the 626-page stack test result, and analysis by additional medical professionals. Thank you.
Thank you.
I will probably run out of my 3 minutes, Anthony, and in case that happens, I would like to submit 6 copies of what I'm already sent to.
All right. Let's distribute that to the town board.
Good evening, gentlemen. Thank you for the opportunity to talk to you tonight. I will go off the script for a few seconds and tell you that I personally really appreciate the artwork here on the wall that represents children of the Cottage Lane Elementary School, which my children attend. And it's a wonderful school. For those of you who are unfamiliar, it's located about half a mile from ALOOF. It is very close to ALOOF. And for those of you who are not familiar with me, I am a member of Clean Air for Orangetown, and the reason I got involved with ALOOF is because not only that I smelled ALOOF many times as a parent of my children, but because I do care about my children. I do care about what kind of air they breathe in school. They spend their 5 days a week, many, many hours, and it has been of concern to me. I am not a scientist, so I cannot comment on Dr. Vetrano. However, I do appreciate her appearance tonight as somebody with a good ear can tell you that acoustically, that went very well, and I think that's a great thing that we were able to introduce to the public, this kind of conference call. The issue, in my opinion, again, not as a professional, is not black or white. Tonight, I feel it's more gray than ever before. Now let me go to my script. When it comes to Aloof Plastics, our group, Clean Air for Orangetown, CA4O, has one and only one goal: to permanently stop the noxious odors coming out of Aloof for years and years. If anybody in this room needs further clarification that Aloof has been spewing noxious odors onto this community, please talk to me or any of the many Aloof neighbors who are here tonight and whose quality of life has been seriously affected. To set the record straight, I personally appreciate the fact that after over a year of our continuing advocacy, the NYSDEC finally required Aloof to do the stack testing, which was done on June 29th, 2017. The 600 pages long report is yet to be analyzed and translated into the version of the English language which we can all comprehend. We're awaiting for a full and unbiased scientific opinion on that important document that, among other things, analyzes the specific VOC compounds as well as aldehydes such as acrolein, which are coming out of the stacks. In an email to CA4O dated October 12, 2017, George Swikert, who you already heard about, the Region 3 Air Pollution Control Engineer states, Heather quoted some of it, "You can see from the first run of the repro line, there was a problem. Outlet concentration higher than inlet. This was caused by the boost pipe using indoor air. The removal efficiency of the carbon unit was extremely low, indicating that it is not an effective way to control aldehydes. The stack test results show that the carbon bed is controlling emissions at a very low rate. We are currently having discussions with Aloof to change to a different, more efficient piece of control equipment. A scrubber, since all of the emissions are miscible, is being discussed. I also personally appreciate the fact that the town has hired TRC Solutions to conduct ambient air testing. And I just feel it's important for the public and for the town board to be reminded that I have done the research into TRC Solutions myself over a year ago. I have been talking to Tom about it many times. And my concern had to do with the fact that by that point, a year ago in October, we had only one very brief and very questionable 2-hour analysis of the ambient air conducted by the DEC that we have found many issues with. So I took my time and found a company that I hired not because of health risk assessment, but because of their expertise in collecting ambient air. I understand I'm out of time. The rest of my comments are submitted to you. I will skip to my conclusion. I do urge you to please read my comments and revisit the EOC document that Heather Hurley mentioned to you, the study we commissioned and we paid for back in July. And that study sheds a very important light on a problem that has not been addressed to this date, but it has specifically to do with odors and the totality of the odors and the scientific measurement of the odors. Please take your time and reread it if you haven't. I forwarded this to everybody here. In closing, today is not the day to make closing statements on Aloof odors and health risks. Today is another page in our quest for answers. That quest does not terminate on November 7th or on November 10th. Together, we can make our air better. Thank you.
Thank you.
Good evening. I'm Dr. Maria Jose Romero. I'm a clinical child psychologist, and I have a master's and a PhD in sociology. 30 years of experience in program evaluation and policy analysis in early childhood and elementary education, and more recently in higher education. I spent a number of years conducting research on chronic school absenteeism, and this research informed New York State's policy on educational neglect. One of the findings of my research was on the role of children's health, specifically chronic health conditions, in their relation to school absence. Chronic health conditions are among the most important predictors of school absence, and the single most important predictor is asthma and other respiratory problems. Asthma results in unnecessary visits to the emergency room, large number of days of school missed, tremendous amount of health expenditures, but it also has a spillover effects on the life of the parents and the parents' ability to go to work. It all has spillover effect in the life in the classroom and in classroom instruction, because when kids skip school, then the next day teachers have to reorganize and then catch up, and it has an impact on the learning that other kids can have. Air quality emerges in the research as the strongest predictor of asthma episodes among children. There is strong research showing how variations in air quality are associated to asthma attacks and in turn are associated to chronic absence. We can even predict fairly accurately when kids will skip school, simply based on data and variations on variations in the quality of the air. We also know that the highest incidence of asthma takes place among children who live in close proximity to industrial zones. So I urge this town board and the community not to take the data that were collected in this report lightly. The research suggests very clearly that the negative impact of air quality on children takes place at levels that are far lower than what is established by EPA standards, okay? The methods followed in this research are very serious, very rigorous, very sophisticated. There are statistical techniques used that allow us to exclude factors that may impact on the results that we don't even know of. So there are very serious people in many universities across the United States looking at this research. I'm particularly concerned about how the risk assessment downplays the role of acrolein, a known substance to cause serious respiratory problems, particularly in children. So that's the message that I want to say. You know, there is ample research, and maybe we should not just look at the research by toxicologists, but look at the public health research as well.
Okay. Tanya Whittick. Is Tanya still here?
Good evening, Board. I'm Tanya Wittek from Tapan. And first of all, I'd like to thank the Town Board for sharing the initial phase of the air testing with the community along with this risk assessment. I realize that it must have been a tremendous rush to prepare a risk assessment so quickly. Thank you for organizing the conference call with Dr. Vetrano and allowing the community to submit questions. This has all been moving very quickly, and the public is, and it's kind of difficult to keep up with all the information that's coming at us. But I think that's a really positive thing. This is the beginning of the collection of data, which is very valuable for this community to improve our air quality, because I believe it can be improved. When we're talking about comparing it with, you know, we don't know what we're comparing it with, but New York City, GWB, you know, I think that we can do better than this. I really believe that. That's why I'm here. Hopefully there'll be a sudden improvement in the odors from Aloof this month. Even if this is the case, this is such an important time for our town as we reflect on how a situation like the one at Aloof happened and how we can prevent this from ever happening again. The ongoing issues at Aloof address problems which are much larger than the fine structures, although that is important. I want to reiterate that the New York State DEC Air Pollution Control Engineer, George Swikert, who's responsible for Aloof, is also responsible for overseeing 7 counties in New York State. I know I've said this before, but every manufacturer with an air permit in New York State in 7 counties. That's a lot of work for him, you know. So how can the town best support the DEC in order to make sure that manufacturers operating in our town are not jeopardizing the health and quality of life of residents? So I would like to address the position of the public health engineer. I realize that the town board approved this in the budget for this year, and I appreciate that. However, the fact that it was so difficult to find a qualified applicant is concerning. So I'd like to know what the status of this is, and if this position will be restructured in terms of the job description and the salary so that it will attract a senior level engineer. The search for this position must be wide, and the job must be posted on as many online job sites and relevant engineering sites as possible. Our town is beautiful, and there have been efforts in the town to set back ugly manufacturers from the street and hide them behind trees, but they cannot be forgotten. We desperately need a highly skilled engineer who's able to understand and assess not only the new manufacturers who are eyeing Orangetown as a place to call home, but also to help regulate the existing manufacturers. When DEC officials investigated Aloof beginning in the spring of 2016, after many complaints from residents, there were serious problems with the lack of maintenance records. Even if the current ventilation upgrade is successful, it's months behind schedule, the town must ensure that this system is being properly maintained. After the various testing which took place this summer, the DEC is now saying that scrubbers will also be installed. This is something that we advocated for a long time ago. If scrubbers are eventually installed, they're extremely expensive to maintain. The community needs to be reassured that the manufacturers operating here are properly maintaining their equipment. This was a big factor contributing to the escalating problems at Aloof. It must be up to the town to work together with the DEC, otherwise the public's health and quality of life will be jeopardized. So, thank you.
Thank you, Tanya. Robin Skura?
Hi, I live at 42 Yale Terrace in Blauvelt. I'm right around the corner from Cottage Lane and Murphy Court, and I can tell you that the smell is horrifying. Doesn't matter if it's morning, noon, in the middle of the night. Last year I sat here and had to shut my mouth as I listened to Mr. Brenner just deny all the issues and just say, oh, we just need a little more time to get everything resolved. It's been a year, nothing is resolved. Speaking of time, on October 30th, 2015, my 51-year-old brother that grew up at 38 Yale and lived at 568 and 570 Route 303 was diagnosed with esophageal cancer. A young, healthy white male, non-smoker, non-drinker. He wanted more time as well. He wasn't allowed to have it. We buried him on August 24th, 2016. This community is in desperate need for a health study. Esophageal cancer is rare, but I'm telling you, I know 4 people, 3 of whom have passed away already. It's on the rise in our community. With these odors, the environmental concerns, we really got to step it up now, and I think that's what everyone's here for right now. So we're looking for just, we got to stay on top of these manufacturers. If they're here, we need to regulate them. Just look at all the violations they've had and how they got away with it, and then it turned into an issue between the Blauvelt volunteer firemen and Orangeburg and who was accepting the fines. I just don't understand it. We really need to do, some more work and stay on top of it. But thank you for all these people that I've met that are working really hard to step things up. If I hadn't met Tanya at the crossing guard and discussing the odors that we're smelling, where would we be, I've lived here for 45 years, and we didn't know where to go with all the issues. So thanks to everyone for their efforts, and that's it. Thank you.
Okay. Robert Wells?
I don't have the organization and prepared statement that all these people had, but first I just wanted to thank the board, because I do think you guys do a lot of great things in this community, so thank you. I wanted to first address the Hillside project. I kind of wanted to make you just really aware of kind of what's going on over there, and it was alluded to by a few people, the dust they're supposed to be spraying. I got a 2-year-old I had to take inside and a pregnant wife that I had to go inside with. What day was that? Saturday or so? Was it? Yeah, I mean, it's nonstop. It's nonstop. That's not right. I mean, so my question is, what oversight are you guys having on this? How much control do you have? And I didn't even realize that you guys appointed the board that approved this project. I mean, I see your sign, Troy Devaney, it's election year. I played in your golf tournament. I've supported you. I'm really going to rethink that now. I got to tell you. I see your son at the pool. I see you at the pool. I think you guys are great people. I think you're nice individuals, but I think your perception of things is just way off on certain issues, this being one of them. So, I think when it comes time to pull the lever, people are going to speak. and you may keep your job for a few more years, but that number's going to grow. You keep doing things like this in this town. As far as the study, I have no clue what's going on with the Louvre. I'm kind of like, you know, new to this whole thing, but I'm going to tell you, I am a doctor, and I'm going to tell you right now that study, I don't know who that woman, I don't know who funded it, but 5 days? You guys have to be kidding me. You're putting lipstick on a pig. And I heard Mr. Valentine, I think, ask the doctor, I'm paraphrasing, I live in Blauvelt, you know, I have my kids, my grandkids, is this safe, right? And that was your question. That's very scary that you asked that question, because over 20 million people asked their doctor within five and a half years if Vioxx was safe, and they said yes. And that study was done over the course of years. My point is that you're asking a doctor who doesn't even have the degree to tell you if it's safe, okay, over a 5-day study when Vioxx was studied for years, and it contributed to 28,000 heart attacks. Stop believing what they tell you. It's lipstick on a pig, man. You guys are smarter than this. Anyway, I'm done. I gotta go home. I'm tired.
Ira Steinberg, 10 Murphy Court. I appreciate that the town conducted the air quality study. I'd appreciate if Aloof had contributed to paying for the study as opposed to just our tax dollars paying for the study. And second point, I just want to quickly add, I appreciate that you guys on the board hopefully can recommend to the ZBA an architecture review in 2 weeks when Aloof has their project on the board and on the docket for 2 weeks, when they plan on getting approval for a new factory, that you guys recommend that they don't get granted any variances. Thank you.
Thank you.
Hi, my name is Natalie Bullman, and I'm a PhD earth scientist at the Lamont Doherty Earth Observatory. I'm a senior scientist there. In fact, there were 3 other PhD earth scientists from Lamont Doherty in the audience this evening. The other 2 aren't here. I'm also a local resident in Palisades, New York, and I have 2 children in the South Orangetown Central School District. I just had a question for you guys. How many people felt that it was easy to follow the report that that Karen gave earlier today? Did you guys follow everything she was saying?
Natalie, if you could just, you asking a question or making a comment to the town board?
Okay.
It's an interesting question, but you're not conducting a Q&A with the audience right now.
So my comment is, I found it really hard to follow what she was saying. And when I heard today that she was going to be presenting scientific information, I was expecting to see a PowerPoint presentation, some visuals. I have never been to a meeting where someone's going to show some information that I'm supposed to absorb, some numbers, without some visuals to back them up. I mean, it was just impossible to absorb what she was saying. I couldn't absorb it, and if I can't absorb it, and I'm a scientist and this is what I do every day, then I'm sorry, but it's really unlikely that most people in this audience were able to absorb it. And so I think that was highly ineffective, and I don't think that any of us could come away with any good understanding of what she learned from this report.
Because it is, as I can see tonight, I know why I live in Orangetown for the past 40-some-odd years. It's a great town. It's filled with great people. The people of the town of Orangetown are great. But there's a lot of underhandedness going on in this town when it comes to the ZBA, the planning board, and what is happening in this town. There should be no one allowed to come in on a holiday and take down trees. This should be a fine of $200,000 to come in and do that to a town. Unless you start to establish fines and codes, the developers, who many of you have benefited from through contributions, through your campaigns, this has got to stop. It's environmentally wrong. It devalues the community around it, the residential community. Keep in mind that any commercial development in this town only benefits the commercial base. It does not benefit a residential base. That is what is true. So we can have all the, in Eamon Lane, God bless him, an Irishman out from Ireland, he's done well. Let me ask you something, Mr. Lane. What have you done for Orangetown? What community center have you built? What park have you saved? What have you done for Orangetown? You're a successful Irishman, and God bless you. But to the same token, as a developer, you should give back to this town. And from what he already, I think, is involved with another big building in Orangetown. This is wrong. And let me tell you something. The people in this town speak by voting. And the environmental issues are a big thing for people of young. I've lived long enough, and I'm very lucky to have lived the way I have lived, and I'm very lucky to have lived in Orangetown. But let me tell you something. There's a new world out there, and unless you're listening, you're not going to be up there.
Thank you. We've certainly got an earful tonight. At this time, the town board, for folks who don't come here that much, you're probably aware we try to provide some answers, some responses, some clarifications before we move on to tackle the questions which are on our agenda for tonight. And maybe we could start off over on the right-hand side. Dennis, do you want to start?
One of the things I would like Jane Slavin to talk about Hillside, what was done in Hillside. And one of the prior speakers talked about me talking on May 13th. Ironically enough, I ended up watching it on YouTube today just to see what I did say on May 13th. And I still say the same thing. And I still say it's a commercial piece of property. And, you know, it's 10 years, you held it up, which is fine. And what the town did do at the time, the town did adjust the laws. It wasn't that they avoided the law. You know, it was a thing where, for whatever reason, because there was a commercial piece of property next to it, the trains, they didn't have to notify the residents. That was ridiculous. No, that was bad. But it's a thing that had to be changed, and we did change that. And we tried to adjust all along the line. In terms of what was done on the Columbus Day, the new head of the building department will address that. I will say one other thing. You know, I listened to everybody who's here. I see the frustration, particularly on Aloof. It's really a serious problem. And matter of fact, the last speaker who spoke from Lamont Doherty, one of the reasons that Tom Divney ended up getting the speaker here, getting the Dr. Vetrano here tonight, was all we had was a bunch of data. We were looking for what's the analysis that goes with the data. And again, maybe it could have been done better, but that was a very good step from my perspective in terms of what Tom did in getting the speaker. It's always, you know, I've been here 18 years. Maybe that'll be the end. I don't know. But I've been here 18 years. And one of the speakers who just spoke just before, who was a town councilwoman, while she was here, cost the town $8 million. And maybe if she didn't help cause the $8 million that the town got sued on, all right, maybe we would have had a community center. It's always great to listen to this stuff week after week from the same person. It just drives me insane, all right? Is that petty? Yeah, I guess it is. But I'm telling you, this is week after week for 18 years. So it's a thing we will try and do better. I have said about the land use boards. The land use boards, I've been around a long time. Most of those people I did put on the land use boards. I don't think it's an easy job, what they do on the land use boards. Planning board, zoning board, architectural review board, all right? It's a thing, we always look for volunteers. We'll be looking for them again in January. Anybody who wants to serve on the boards, we'll interview you if I'm still here, and we'll put people on the boards. They are like you, just residents. That's what they are, all right? And I really believe, some people may disagree here tonight, I really believe that the people on those land use boards have protected the town. Now, you could pick in Elitech, you pick Aloof, or you can pick Hillside. all right? But if you look at the big picture of the town, in terms of how the development is in this town compared to other towns, it's not even in the ballpark. It's not even close. As somebody, also a former councilman said, it's a great town. All right, are there things we could do better? Yes, all right, but it is a great town.
Jerry? Oh. Maybe we should, you want to finish up comments, and we'll have a presentation by the building inspector.
Starting off with regards to Hillside, I'm not going to stand behind and say that I've been here for 2 years and it hasn't been there before. I did get a call. I agree. My understanding is that the border was there. I was at the planning board meeting, that they got the approval, and they pretty much, the builder gave in to everything the planning board asked for. When I saw it, I wouldn't say it's devastating. It probably is. It is devastating. There are a lot more trees than were anticipated. I thought the border was going to be larger than that. It appears that it should have been larger than that. You know, I don't know how you turn it around at this point in time. Yeah, I don't know what to tell you. I got a call. I went over and looked at it. I mean, we'll see what we can do with it. We'll see if we can make, they're not going to put in those trees again. It's gone. As far as the boards, I worked for the town for 35 years. Anybody that came into my building, which was the police department, I treated as a neighbor. I think that everybody should be. I think our department heads we'll get to them, and we'll make sure that when people go, they're treated like they are neighbors. You know, otherwise we'll take down the town of friendly people. As far as Aloof goes, it's been a long battle. You know, TRC was agreed upon. I think we did get results. Maybe they can be presented differently, but you know, it's certainly, and I think you said it's a good start. It's not the end. You know, we know that we still have a battle with them, and we'll go forward with it. But all in all, I thought that the night was productive in terms of what was said and what we've accomplished so far, and by no means do I think that our fight is over. So that's pretty much it for me. Thank you.
Thanks, Jerry. I guess I'll go next, and I'll hit a couple of issues. Number one, on Aloof, the company dragged its feet, utterly neglected its responsibilities and the concern for neighbors. And, you know, it's great after so much struggle to be at least on the verge of having the overhaul of the odor system installed and a chance to kind of measure its effects. And of course, getting there has been a long battle involving the ZBA, the local court, the DEC permitting process, and it's all been fueled and motivated by concern, I think, by this board for the community's well-being, and really by the leadership of the community itself in calling for increased attention. And I think, you know, there's a lot to be proud of in that. And there's still questions that we still need to work on. And so we're going to keep focused on that. But it is something that we've come a long way on. And now we're in a position of measuring the results after the final odor control elements are installed. And we'll have a chance to see what that really smells like. And who knows, you know, we'll probably be right back kind of fighting for improvements the next day, but let's see. The question of Hillside, it's a project which I had opposed when it came before the planning board. This is a question of you know, a case which has been litigated. The developer, the community, the courts. It's really unfortunate that ultimately it was successful in having that plan go forward. I will say that you know, and we're going to have Jane Slavin come up in a minute or two and talk a little bit about it, but, you know, the question of tree preservation, you know, the inspections, and I want to hear more about how this dust is getting controlled, but as far as staking those lines and making sure that the areas of work are what are on the plan and not invading areas that are supposed to be preserved, I think we can have a high level of confidence that those controls are in place. The unfortunate fact is that the overall development was approved, And so now the building department's in the position of making darn sure that what is on the map is what's built and not something else. And I think they're doing a pretty good job with that, kind of chasing after those inspections and making sure they're in compliance with what they agreed to. The question of the, I just want to mention too, you know, Barb Bordello, I think she left, but you know, she speaks so thoughtfully, and I think, and very, very well actually, for someone who apologizes for not being an experienced public speaker. And I just want to credit her with that, because I think she brings a good perspective and often a focus on seniors, which I think is really important. On that note, and for Mrs. Blake, you know, the town needs a community center. And I think actually we've all talked about this, and it's a part of our concept for improving our park center, our Parks and Recreation and community center kind of planning overall. And right now, you know, we're kind of playing around with concepts for how a community center could be fit in various locations. And it's very much a concept which I believe is alive right now, a shared use facility that has room for meetings and programs for seniors, and also for other kinds of activities by other folks in town. And it's a concept which was on the table a while back when it was associated with a pool project, which ultimately was defeated by public referendum. But nonetheless, the concept of a community center with amenities for seniors, I think there's a long conversation supporting that, and that there's a way forward on that now that we've dealt with the kind of the bulk of the burden on the Rockland Psychiatric Center site. And I look forward to promoting that concept and figuring out maybe how that can be done. I just wanted to mention also that you know, Esther keeps bringing up the streetlight project. The streetlight project is, to repeat, you know, it's a conversion of all the existing lamps to LEDs, which will save the town hundreds of thousands of dollars a year. And you're going to see shortly, in the next month or so, the fixtures getting swapped out. And it'll happen gradually over a series of months around town. So keep a lookout for those trucks and stay in touch on that. But it's gotten to the point where we're doing final decision making, and the operation is actually going to take place. And it's actually the timing on that, I think, has been good, because the nature of that project was that Clarkstown was a little ahead of us on it, which was a good thing, because they were trying to figure out what kind of lights to get, and then we could go and look and see what they had. Places that already have converted LED lights, in most cases in Westchester, already owned their street lights. And so the additional process of doing cost-benefit analysis of actually buying the street lights and then converting them was what this town took on. And I just want to credit our finance team, Jeff Bensick and his folks in finance, town board obviously for supporting it and kind of querying and interrogating the cost-benefit, and our legal team for getting those contracts and agreements in place with O&R. And you know, we're moving forward on it. It's a pretty exciting project. It's good for the environment, and it's going to be good for public safety and lighting too. And hopefully, Esther will see a difference on Route 340. So with that, I'll turn over the microphone to Tom Divany to continue responding to public questions.
Okay, thanks, Andy. As far as the senior center, I've spoken with Mrs. Blake, and I think it should be in line with what Andy said. It should be a community center for seniors, for youth, for the whole entire community. And I do believe with the development at RPC, it should be tied into that development over there, either using money that we get from lots over there to develop the community center on town-owned property, or developing at the RPC property right now. But I definitely believe that we should be doing that right now. We will have monies coming in, and if we don't earmark monies for it, we'll never have that community center. The other two issues are both Aloof and Hillside, and I mean, it's kind of similar situations on different parts of town. You have residential area, you have an industrial area, and you don't have a buffer zone. You don't have a buffer zone at all. And I've spoken to Mr. Kleiner on this a number of times. It was poor planning 50, 60 years ago to allow those areas to be right next to each other. But, you know, it doesn't excuse the fact that we've got to deal with it. You know, you drive down Railroad Avenue, the trees, you know, were nice to look at, a nice, you know, buffer zone from 304. You know, I emphasize that they came down, and there's really nothing, we can't turn back time. As far as it going forward, you know, we've hired Jane, and Jane is all about codes, but, you know, if there's dust that is not being taken care of, they should be fined. If they're not, you know, guarding your trees or they're not marking the trees, they should be fined. If there's cars that are illegally parked on streets, they should be fined. And they should be fined according to laws and revisions of the town code regarding fines. It's not, you're going to get fined $5,000. For corporate entities, it's $20,000 per violation per week. And if you do it again, then it goes up to $40,000. If you do it again in a certain period of time, it goes up to $60,000 per week. Part of the reason we did that is because corporations have a lot of money, business entities have a lot of money, they should be held, you know, to a higher standard, and they should be fined more because they have more money to lose. So that's how, that would be my way of going forward. You know, I can't go backwards, but if this company is not doing what it's supposed to be under any of the approvals, if they're violating any town laws, we gotta write them up, and they should be fined.
Who's responsible for overseeing the project?
We were going to have Jane Slavin address that. I'll let her address that. She's in charge of the building department. As far as aloof, a lot of people in this room have invested a lot of time into this issue. I've invested a lot of time into this issue. I have a daughter who was removed from a soccer game twice on Sunday because she had asthma attacks. So she had an asthma attack, did the inhaler, had a second asthma attack, did the inhaler. So the air quality in town is very important to me. And I've, you know, listened to the complaints of the residents. And here's the deal. Regardless of what TRC says, it stinks. I've been out there. It smells. And I know you're frustrated. And we have tried to do what we can do, and we hired TRC Consulting. That was at the suggestion of Clean Air for Orangetown. And we took your comments into consideration. We hired them. We've done testing. We weren't trying to give you a haphazard explanation tonight, but there are concerns, and a lot of people wanted to know what was going on. So we tried to do the best we could and accommodate the residents of Orangetown so they could actually hear from the expert that we hired. And, you know, some people might, you know, dispute the science, but we're not trying to trick the town. We're not trying to mislead you. We're trying to get the answers. And that's why we hired TRC to begin with. Again, I mentioned we've increased fines for corporate violators. That's part of, you know, changing the code so that we can deal with these issues. We're still working on, Tanya Wittick mentioned the healthcare engineer. We presented a candidate to county personnel, highly qualified, and graduated with an environmental engineering degree, has done field work for DEC. They disregarded some of his qualifications. He's not eligible for the job. So I spoke with Joe Moran the last 2 weeks. What do? You can do a junior healthcare engineer, which, you know, doesn't solve the problem because the town needs an expert. And we don't need someone to learn while, you know, doing that job. So I've told Joe we've got to repost at a higher salary, and we've gone back and forth, and we're trying to determine what that salary would be, because, you know, originally they wanted to do 65. We raised it to like $85,000 to $90,000. We only had 3 applicants, one who was highly unqualified, one from the county that wanted the job and then withdrew, and then we had another applicant that had some very high qualifications, but the county, you know, disregarded it. So we're going to have to raise the salary, and we will do that. You know, Andy had a great suggestion a couple months ago. We hired Sander Bonville, who's got 30 years of investigating and evaluating environmental settings. He has a background in analytical chemistry, environmental sampling, laboratory management, medical research, risk assessment, data management. He's working with the town, and he has worked with the town on the DEC consent order, and Andy mentioned we're going to have a public hearing in a couple of weeks regarding odor, particulate matter, and opacity. So we are hiring experts to get a better handle of this. We hired Jane. Jane knows the code. Jane knows what we need in this town. She's a no-nonsense person who will bring this building department to the 21st century. And, you know, we have worked with the DEC. We have. George Schweikert, you know, some people like him, some people don't, but he does get back to us. He does go out there. He is responsive. He, you know, he's working with us, and the DEC has worked with us regarding the odors. I mean, they got him to sign that consent order. The consent order is requiring them to install that piece of, to do the ventilation system. It's going to be here tomorrow. We've asked you to be patient. I know it's hard to ask you to be more patient, but it's not that we don't want it to be installed. It's a complex issue, and we have to have this piece of equipment to be installed to turn that ventilation system on, which is going to be 7 times stronger, and it's going to take all the fugitive emissions and force them through the stack. Once that happens, the hope, the prayers of this community are that the odors will be reduced significantly, and that's what everyone on this board, everyone out there wants, because regardless of the TRC report, it stinks, and I'm not disputing that. I was out there yesterday. Allison Sullivan called me. She says it stinks out here. I got 3 other complaints. We had myself and Joe Moran and Guy DiVincenzo. We did 2 of those canister monitoring. The smell was more of a chemical smell. It wasn't a sweet smell. But it was very windy yesterday, so you would smell it, and then it would be gone, you know, and there were certain areas that it smelled more. So it smelled. I'm not going to dispute that. There was another night I was at Louis with other members of the town.
Did it smell like trucks, cars,
It smelled. Are you trying to do your best George Schweikert imitation? I'm just saying, I'm saying it smelled, and it smelled more of a plastic, but it did smell, and I admit that. And I never disputed it, Mr. Witek, and I've never tried to act in any way to not help this community on this issue. We're not against you. We have never been against you. We're trying to get this accomplished. No one on this board doesn't want this to be done. We're all working so it doesn't smell in Orangetown. I never said you weren't. But we're working hard, and we're trying to get it done. Emails I respond to every day. I get emails, and I'll give you an update. You have questions, I'll try to answer them the best I can. If I don't have an answer, I'll call George Schweikert, or I'll call someone who may have the answer. So we are doing a lot. You guys are doing a lot, and we want the same thing. We don't want any harmful chemicals in the air. We don't want to have anyone be hurt by this company, and we don't want it to smell, because that's what the people around that area, that's what they want. They don't want to wake up where they can't go outside, they can't enjoy their deck, they can't enjoy a barbecue. And November is coming quickly, and that part will be installed, and hopefully I won't get any more emails from you guys, and that would be great.
Listen, we're going to have Ms. Slavin up in a minute, but we do really have to move on. Paul?
Okay. Just a couple of quick things. I also support a senior center or a community center. We've talked about it quite extensively in the last couple of weeks. with Andy, Tom, and the rest of the board, thinking that since we finally got rid of the burden of the old buildings at RPC, that takes a big load off the town's back, and we will have some money in the coffers, so that it was a good thing. We actually been talking about places to put it. So that's how far along we've come with it. It hasn't been designed yet, but it is a topic of discussion, which it hasn't been since I've been on the board. So I want you to know it is now, and it's something that is in our sights. Hillside. I got to be honest, Hillside happened in 2007. I wasn't here. I didn't appoint anybody to any of those boards. It was Tom was here, I guess, but I'm telling you right now, I was not here. As far as the construction going on now, I almost feel bad for Jane because she was put in the office, I think, the day they were cutting down the trees. She was became the building, in charge of the building department. But I have total faith that she will make sure that they follow the letter of the law, but I'm not going to speak for her. I'll let her speak for herself. Aloof. I'm on the phone with Tom 5 times a day, 6 times a day, talking about various town issues. The majority of the time, it is aloof, and what to do, and reports, and following up on emails, and the studies. And from the very beginning, when Allison and I talked about this, I said that my main concern, my top concern, was to make sure that the residents were healthy, and the second one was the smells, because the smells affect our quality of life. So the last few weeks, there's been a lot of going back and forth on don't take your children on the path, and, you know. So I think the reason to rush to get her analysis out was to, although it's not 100% finished, was to assure people that as of right now, from what all the data says, it is safe to go on the path. We will follow up with the second report, and the health and welfare of the community is my most important thing that I'm here for. As far as the smells, I know it seems like it's taken forever, and I agree with you, and I wish we could make things move faster in government. It's not like private, like owning your own business, when I can get things done overnight if I have to. It just takes forever, and you have to go through a lot of steps, and they drag their feet, which made it take even longer. But I think we can see the finish line in sight, or at least what we're hoping to be the finish line. And if the upgrades that they installed do not remedy the situation, then we can take them back through the court system. And they won't have that hanging over our heads saying, you know, we are putting money into the factory, because they put the money in, and it's either going to work or it's not going to work. My hope is it works, and we're all, like Tom said, having emails about different subjects. But it's not over. Even if the smells go away, we have to continually check the stack, as was said, and we have to do more testing to ensure that not only Aloof, but all of the industrial factories in our town are safe. Me and Tom have also talked about the health engineer, and I have agreed that we have to raise the salary. I mean, if you can't get a qualified candidate, there's a reason. And I don't think it's because everybody has a job in America. I think it's because it's not paying enough for a qualified engineer. So we're going to have to raise the salary to pull in that engineer. And I want everybody to know I appreciate everybody coming. I really do. And I appreciate the community input and hearing about the different projects and your perspective on things. I'm not always excited when people get up there and yell at us and tell us, you know, I'm going to take you into account for it. I'm doing the best I can for my community. I really am. I mean, this is a part-time job for us. I put in more hours here than some people put on their full-time job as a town councilman. But I appreciate people coming out, and I appreciate that majority of the people here tonight had civility and got their point across, which is, you know, I'll grant you the same courtesies as you grant me. So I appreciate everybody coming out tonight. That's it for me.
Thanks, Paul.